Hello, hello. Good evening. I don't even know if you'll be able to hear me or see me this evening because it is just all sorts of chaos on my screen and on my end. Would greatly appreciate a comment if you're able to hear me and see me. Just give me a nice little hello in the comments so that I am aware. Tonight, we're going to talk about the dark side of myofunctional therapy. I have been MIA for the last 2 weeks. So, I'm Carice Laguerre, your Myo best friend. I'm typically here every single week giving you some new, live, fresh information about myofunctional therapy, and probably the only person being genuine and honest about it, because there's a whole lot of people that will fluff you up about this field, and it's not all warm and fuzzy. Um, I was MIA the last 2 weeks, so we didn't have any lectures the last 2 weeks. So now I'm back. I was busy with Dental Culture Con. If you haven't heard about it, time to Google it, okay? dentalculturecon.com. It is like the most forward thinking conference in dentistry. But unrelated, I'm here to welcome you tonight and to really dive deep into these topics. I am very excited about talking about the dark side of myofunctional therapy. I think I've been wanting to talk about this for a little while. There's multiple aspects of it from a patient perspective and from a practitioner perspective. And so we're going to hit on both of those. Again, on my end, my screen looks super delayed, very frozen. I'm not even sure if you're hearing me really well. So just drop in the comment if you hear me. If you see me, just give me a little hello. That way I know I'm not talking out into the void. As always, I'm going to ask you to like, share, subscribe, or connect with me. If you're watching on LinkedIn, make sure you've sent me a connection request. Happy to connect. It'll keep you up to date on when all of these lectures are on. And if you are watching on YouTube, don't forget to subscribe or like this. And every single comment matters, because in order to keep this going, it's got to keep getting its own exposure. I would love to change this welcome slide, and everything on my end is just so slow. I don't know what's happening, but I didn't want to be super late by trying to like restart the whole computer. So this will be a very interesting one. Let's see if my slides move in the way that I would like them to move. That's great. All right, so we got a new slide going. Awesome. So let's keep this going. All right, let's dive right in. Yes, slides are working. Amazing. So, two aspects of the dark side of myofunctional therapy I will be exploring tonight. There are darker sides of this for patients. I think everybody thinks we are doing just such wonderful things for all the patients and everybody. There's no reason why people shouldn't want myofunctional therapy, and it should be like the very first thing that a lot of people are talking about. And if you're holistic or you're crunchy or you're a granola person or whatever you want to call yourself, you need myofunctional therapy in your life. James Nestor said so, and so yay. But there's really downsides to myofunctional therapy. It's not all, peaches, cream, fuzzy, fluffy, happy unicorn rainbows, okay? Same for practitioners. And I think we've talked about some of the practitioner stuff before. And so some of the practitioner stuff might sound like a little bit of a repeat, but I think it's important for us to go over it, because the more you hear these things, the better informed you will be to pass on this information to a loved one, a friend, a colleague, somebody who's inquiring about myofunctional therapy. And this shall live on in the YouTube forum for others to see. That way, people can understand there's good and bad to everything. Myofunctional therapy is no exception. It has its highlights and it has its lowlights. So let's dive into some of the issues or the dark truths for patients. Now, I'm going to break down each and every single one of these. But I think for most people, many practitioners would agree with me on. So let's hop in and talk about it from a patient perspective. But before we can do that, we have to understand what myofunctional therapy is, right? Now, everybody who's ever heard of myofunctional therapy, what's the first thing that you do? Google it. Yes, you Google it. And what's going to happen when you Google it? It's going to tell you that it's a set of exercises. YouTube videos will pop up, reputable resources such as the Cleveland Clinic and Healthline will tell you right off the bat it's exercises. And that's what you do. You do these exercises. I mean, that's absolutely wonderful and fabulous, but it does not tell the entire picture, the totality of it. And where that becomes dangerous and a dark truth in that it's not just exercises, is that people are underprepared for the commitment that is required. Okay. I think when we misspeak and when we talk about it as in like physical therapy, and as somebody who's done physical therapy multiple times in the past to rehabilitate after certain injuries or after certain things, or as a precaution to prevent a surgical procedure, myofunctional therapy is nothing like physical therapy. And physical therapy was real, like brief and to a point, and we were doing exercises to work out like one specific thing and working towards that goal. And whether we met that goal or not, like it was not, it was not the same. I'm not looking for long-term patterns. I'm looking for a short-term strength and achievement with potentially some stuff I can take home. And so when we start misspeaking about it, it makes it seem even more like it's just exercises. And the problem with that, where it becomes a dark truth, is that they're not understanding that there's going to be levels to this. It is so much more than that. It is going to require more than that. And if it is just exercises, I can YouTube that. That's really all I need to do is I need to go on YouTube, watch some videos, do these exercises. And we'll kind of get into a little bit of what goes wrong with that a little bit later when we start talking about how it can do harm. So, if you've ever heard myofunctional therapy, I do exercises and like that's it, it's just some exercises, I I want you to run as fast as you can. They shouldn't be able to catch you, just like the gingerbread man. Okay, make sure you avoid any practitioner as a patient or potential or prospective patient. Avoid any practitioner that is explaining myofunctional therapy to you as just some exercises. I go above and beyond in my consultations to take that myth and throw it in the garbage. You don't need a myofunctional therapist if it's just exercises. Technically, at that point, you're just mewing. Like there's nothing else that you're really doing. You're not getting any long-term functional gains and you're not doing any neuromuscular re-education. So yeah, sure, do exercises. And if I want six-pack abs, all I have to do is sit-ups. And if I do sit-ups every single day, I should be able to achieve that, right? No, you have to ask me about my lifestyle. Like, how many sit-ups am I doing? Is there any progression to this? What muscle groups am I really trying to work by doing just individual sit-ups? Should I do work my obliques? Should I do anything that's going to be rotary in nature? Are there any other exercises that I should be doing? That's one point. But then what else am I doing? Do I live a sedentary lifestyle? Am I just doing a couple of crunches and then that's it? I sit down for the rest of the day at a keyboard and I work all day long. What's my stress levels like? How is my sleep? How is my diet? All of these things are going to impact whether or not you're able to get to your goal. And somebody should tell you along the way that if you just isolate your abs and just do sit-ups or crunches all day, that's not going to get you the outcome that you want. We don't target certain areas, I'm sorry, and achieve just isolated weight loss in a particular area. Your body is going to withdraw the weight or fat deposits or whatever, however it's going to pick to do so. But it has to come along with an entire like lifestyle change. It's not just the exercises, okay? So here's how it really works. There's 3 phases to a myofunctional therapy program. If your myofunctional therapist does not know this, you need a new myofunctional therapist. Phase 1, it really is exercises in phase 1 and phase 1 alone. Okay. When we do a comprehensive myofunctional therapy evaluation, what we are looking at is all of the muscles of the orofacial and the oropharyngeal region. And what we're doing is we're taking a really good baseline understanding of where you are now. So we're going to pinpoint overdevelopment, underdevelopment, asymmetries, compensatory patterns, like what's going on with these muscles. Then phase one is going to address some of these isolated muscles, and it's really going to be exercises to work on where you are deficient. After that, once we've created balance, a harmonious balance, and a wonderful foundation upon which we can now coordinate the musculature. So we've eliminated some asymmetries in function. We've established isolation of muscle groups. That way we can get to actual development of the musculature and not a compensatory pattern. Pardon, let me get a drink of water. Then we are going to see, oh my goodness. Then we're going to see that balance. Now we can take that, and phase two can happen. Coordination. If we're trying to change muscle groups, muscle patterns, establish neuromuscular re-education, change how the muscles function just naturally, cognitively reprogram them, you have to actually re-pattern the muscles. You have to coordinate them. That doesn't happen in exercises. It happens in coordinated activities. Like you have to actually now get the muscles moving in their groups. What are these muscles supposed to be doing during certain tasks? So we're not just exercises. Now we're doing activities because we have to work with various muscle groups to coordinate a task. If that is not just an exercise, you shouldn't find that just freely and readily available on YouTube. And if you do, be concerned. Phase three, most important. Who cares about phase one and phase two if you don't establish phase three? Phase three is what gets you the long term results. Phase three, habituation. Habituation is where we are building it into your daily life. So, your daily life task, now we're bringing a really forward consciousness to it. And at that point, you are going to now be building in those subconscious blocks because again and again with the repetition, we are now creating the cognitive change. That way, subconsciously, this is happening and occurring without the need of help and additional reinforcement by your myofunctional therapist. Your goal for your therapist should be to achieve for you autonomy. You should be able to have your results, own them, and it is you, nobody else. Okay? It is not, oh my gosh, I have to call my myofunctional therapist. I have no idea what to do. Mm-mm. You've established new habits that should be able to be retained. Okay? Independent of needing a specialist. 3 phases. It's not just exercises. And if you are just getting just exercises, or if you're a therapist and you have no idea how you're supposed to phase out into these sections and you feel like all you're supposed to do is whatever cookie cutter list, maybe you have 10 or 15 sheets of exercises and you just hand those out, it's a problem. It's a problem. Okay? Okay. I really dove into what all of that was about, but essentially the only way that you're going to get the neuromuscular re-education is actively having that participation and having repetition. Okay, so all of this is happening beyond and well outside of exercises. So it's not just exercise. Dark truth number 2, it's not a solo answer. Remember this slide because it will come back. It is not a solo answer. You may be in the rabbit hole. You may be online on social media and you're looking at all the things and oh my gosh, is there anything myofunctional therapy can't do? Yeah, there's a lot of things myofunctional therapy can't do, like help with literally everything on this list, at least by itself. Myofunctional therapy has very little to do with the actual impact. Like when we talk about root causes, people are always like, oh, myofunctional therapy is dealing with the root cause. It's really a misnomer. it's dealing with an aspect of it. Function, really important, but structure is also super important. And so is diet and lifestyle and energy and all sorts of things. Everything comes into play. You don't just develop digestive disorders without having function. You develop that as a combination of a bunch of different things. You may have been exposed to certain bacteria as you were coming through the vaginal canal in birth that altered the flora of your digestive system, and now you've got all these different problems, or maybe something wasn't addressed, and it just winds up being a sequelae of events. Okay, how you breathe, how you sleep, how you think, how you cognitively process, how you are presenting in speech, in occupational goals, in reflexes, all of that is multifactorial. And I want everybody to not forget that. Because myofunctional therapy is the answer for one thing specifically: proper oral rest posture. And I genuinely think a lot of people can stop getting themselves in trouble if they would just limit themselves to proper oral resting posture. Everything else is a happy accident. A happy accident. If you do myofunctional therapy, you get proper oral resting posture, and it happens to help you sleep better. It happens to be something that your ADHD winds up not being as symptomatic, because maybe it was a misdiagnosis. So your ADHD symptoms sort of resolve, or some of your digestive issues dissolve, or your orthodontic or teeth issues start to wind up better. That's a happy accident. Nobody's aiming for those goals. And if you are aiming for those goals, you're doing it all wrong. You're doing it all wrong. It's a very dark truth that none of us are actually aiming towards that at all. We're only looking for proper oral resting posture. And if more people would talk about that, I think we would get to a better understanding and more general acceptance of myofunctional therapy, because how do you deal with proper oral rest posture? Like, please Google it. But how do you deal with digestive disorders? Google's not going to show myofunctional therapy as a part of that. How do you deal with sleep? You could see all the sleep specialists in all the world. Very few are going to talk about myofunctional therapy. ADHD. Google these things. Myofunctional therapy is not coming up for any of that. But proper oral rest posture, if we start promoting that, and how many happy accidents occur as a result of that, we may have just found our domain. Okay. It creates a better understanding for everybody involved. You need the proper oral resting posture. And then they know that things are going wrong as a result of that. Okay. Like I said before, none of those issues, or none of the things that we propose or even purport myofunctional therapy to be able to help and assist with, are something that myofunctional therapy or dysfunction in the oral facial region caused. It could be a correlating factor amongst many other things: genetics, what they see at home as far as mimicking certain tasks or speech or function that they see by their caretakers or their parents or caretakers, any sort of diet and the influence of that, their environment, whatever allergies or allergens they're exposed to very early, however they are able to actually like live. If you don't have a stable home, what kind of psychological impact does that have, and where is that now going to put you for being able to resolve dysfunction physically, when psychologically you've got some things that you've got to work on too? Like, what's going on? There's multiple factors. So don't expect myofunctional therapy to be the answer, and like, oh, I've been ignored by such and such doctor, and I haven't gotten any results after doing such and such procedure. Like, we did the tonsils and we did the adenoids, and we didn't get what we wanted, and there's still mouth breathing. Yeah, myofunctional therapy may not have prevented you from losing those tonsils and adenoids. You may have still had to get that surgery. It's a physiological barrier to the goals of myofunctional therapy of establishing proper oral resting posture. So those may have had to come together. In fact, you may need third and fourth help. Like there's a whole team of people that have to work in order to establish what we want. There's structure, there's function, there's tensions and patterns of fascia that are holding on tight in the body, and we need all of this resolved. This interdisciplinary team list isn't even complete. This is just a partial list of the people we could work with. Psychologists, psychiatrists, physical therapists isn't on here. Like there's so many people. This is just what I could fit on this slide. So it's not its own answer. It really needs to come along with other things. So when you're thinking about investing in myofunctional therapy from a patient perspective, you have to think about it from much broader than like myofunctional therapy is going to be the answer for all the things. And I'm going to be able to do this and get to the root cause. You get to a cause. It may not be the cause, unless proper oral resting posture is really the bigger problem that you're trying to deal with. Okay. Form and function have a very bidirectional relationship. It is not just form that influences function or function that influences form. They really interplay off of each other. And so you have to understand that from a structural perspective. We're always talking about airway and who can grow an airway or who can move an airway or what's the most effective thing to move the bone and affect airway space and whatever. It's collaborative. It's collaborative. It's all pseudoscience. None of it has solid enough research that it can be broadly accepted into standardized treatments and protocols throughout the industry. None of it can be generalized to that extent. That should tell you a lot. It should tell you a whole lot. So nobody has the answers. Not Sway, not anybody else. Nobody has all the answers. It is something where you have to work collaboratively and you have to work on both ends, the form and the function. And so myofunctional therapy is incredibly important, but it's not going to be your answer to everything. I am sorry for having to be the person to share that. Okay? I don't want to. The last thing, there's lots of dark truths, but I limited myself to 3 for both patients and practitioners. But the last thing for patients is that it can lead to harm. Everybody thinks, what's the harm in doing myofunctional therapy? There's no harm in doing myofunctional therapy. You can do myofunctional therapy wrong. There's lots of people who do myofunctional therapy wrong. There's lots of people who do myofunctional therapy with a patient. It is completely cookie cutter. They do the same thing with everybody. Visit 1 is visit 1, visit 7 is visit 7. It doesn't matter how you present. I don't even know why they do evaluations, but it doesn't matter how you present. They're going to do the same thing the whole way through. That can lead to more harm than good, in the same way that mewing, quite often, because it's not guided, it's just people doing random exercises or randomly pushing their tongue up to the roof of their mouth, can lead to dysfunction in the same way. They're both harmful. So myofunctional therapy can exacerbate certain things. It can lead to you having more pronounced tongue thrust. You can have jaw pain, jaw issues, oral facial pain. You could create more nasal disuse. You can actually make things worse instead of better. I know a lot of people like to think, myofunctional therapy, it does no harm, but you can mess somebody up. There's plenty of people who have come to me in my practice and colleagues after being with someone else and seeing no results. No results. They're committed. They're doing the thing. No results. Mostly because it's not a custom program to them. It is a program that's general for everybody. And they get no results out of it. And they're worse off than they probably were when they originally met that practitioner. I think that's part of the issue that certain providers have, because there is this perceived hierarchy within the field because many different professionals who are licensed are doing myofunctional therapy. I think there's this hierarchy that certain professions think they have over other professions just based on their initial credential. Whatever your initial credential is, if you have no idea how to do a custom treatment plan, you're likely to do harm. More so than someone who actually understands how to sequence a program in a personalized way to get to an end goal. So be mindful. Myofunctional therapy isn't without its flaws for patients. Okay? I have a lecture coming up in 2 days on Saturday. The OMT Dream Team. Watch that one and you'll really understand how everything comes together better. Okay? End of patience. Okay? Now we're going to talk about practitioners. And practitioners, I need you to watch that too in 2 days as well. But there's 3 dark truths that nobody's talking about enough. Everybody's always, kind of glossing over this stuff. And it frustrates me to no end because the field should be bigger than it is. And there's a lot of scare tactics, a lot of misinformation, a lot of superiority complexes that need to be shot down real quick. It leads to more public confusion as to what it is, what we do, how we work, and it delays us being able to establish some sort of standardized form of how this will be run. But for now, just understand it's not going to be easy. It's not a thing. It's not a thing. And it's not the answer for most problems, which you may have heard already if you were paying attention from the patient perspective. But I had this rant months ago. This slide I just repurposed from when it was just a few days prior. But all the time in Facebook groups, particularly because I'm a dental hygienist, I'm in a lot of dental groups, and particularly these dental groups, there's always somebody posting something absolutely ridiculous. Which myofunctional therapy course should I take? Like, that's the most ridiculous thing. It is 2025. Like, step it up. Step up your game. If you're interested in taking a course that costs you somewhere between $25 to $3,500, you shouldn't be asking on Facebook anything. You should be doing some extensive research as to what all the options are, what you want out of it, and everybody's response to that should really be, hey, what is it that you would like? And not just, oh, I dropped the link to my course. You could do that, but I'll tell you, you've got no morals. It's very unscrupulous to just take somebody's money. You have no idea whether or not you can help them. It's completely unscrupulous. But that's fine. It's neither here nor there. My biggest issue is that makes it seem like it's easy. And I can't tell you how many of the inside groups, so on the external groups, the dental groups, everybody's like, oh my gosh, which course should I take? I want to put this in my practice. Which course should I put my hygienist in? Or blah, blah, blah. Wonderful. It's all wrong. And I'll tell you why in just a second. It's all wrong. But inside of myo groups, I can't tell you how many times I see people who are drowning. I've taken a course. I don't feel like I know anything. I'm not ready to start. I don't know what to do. I feel like I'm going crazy. Like, why is it that everybody else gets this and what to do and how to do it, whatever, and I don't get it? I need to spend so much more money on so many more courses. I don't understand. I think I took the wrong course, or nobody told me that it was going to be like this. To avoid having people on the inside who are struggling, really struggling, are not able to be the exceptional providers, because that's all I want is a field of absolute excellence. We should exude nothing but exemplary work. We should be excellent in all that we do as therapists. You can't do that if you're asking a question getting broad answers from people who also are confused. Like they have no idea what they're doing. You've got to really deep dive to understand and really educate yourself. What is involved? What does it mean to invest in a course? If I'm investing, how am I getting back this investment? Because I'll tell you, when I started, first of all, there was nothing like what I have. These YouTube videos, there's over 50 of them at this point, an abundance of free information on all sorts of topics, from introductory to like all the way to advanced stuff, like how are you dealing with cranial nerves and whatever in Myo. We really need to change up how we are approaching this. It's not easy. You won't just wake up one day and just be a fabulous therapist. It takes work, it takes effort, it takes so much more than whatever you're doing now. If you thought hygiene school was hard, if you thought getting a master's in speech was hard, if you thought getting your doctor's in PT was difficult, I mean, try being in a field that has no regulation. You have no idea how to navigate it. It's not really a thing. And people expect you to just be great at it because you took a 28-hour course. It's odd. It's really odd. I wish we would stop carrying ourselves like that as professionals. And anytime you see somebody post something like that on the internet, shut it down. All the way down. Shut it down. Say, hey, figure out what you want out of this. Here's some free resources. Find free resources, direct them to the YouTube, whatever. Find resources. Tell them they need to figure their stuff out first. And then come back and they can ask based on, I know I want this out of it. I want to do this. I have this much time to dedicate. This is my budget. These are the things that I want to work on and to be able to serve this specific population. What's the best course for me? Boo, I got you. I understand exactly what you're looking for. I'm going to tell you what it is. And many, many times when I'm on these phone calls and people come correct and they have their information, I'm telling them multiple options. I never give anybody just one course. I'm like, there's over 20. Multiple courses will work for you based on what it is you might want. And then from there, research those multiples. It's never a one. I give you multiple. That way you can deep dive into those, talk to all the instructors, and then make a decision. But it's not easy. And that's what a lot of people expect. They go hop, skip, and jump into a course. It's going to be so great. But what actually happens is that while they're working to try to get certified, they're practicing again and again, they're working with family members, they're failing, they have no idea what they're doing, they realize that, oh my gosh, I can't figure it out, I'm stuck on this thing, or I have my husband doing this and he's not getting any progress or whatever. Like, what are some tricks or tips for this? Or maybe I don't know enough, or I don't know, I'm just can't get anybody to say yes to my myofunctional therapy. Is it because I don't take insurance? Is it because my price is too high? I don't know. You're sitting there for 2-3 hours sometimes doing intakes, 60 minutes tops. And I guarantee you I'm looking at more information than most of you do in 90 minutes. 60 minutes tops. Don't waste your time. Don't waste their time. Cut to the chase of what you need to create a custom treatment plan. Stop spending 2-3 hours and then being lost looking at whatever data it is that you collected in that time. Develop a personal treatment plan, you're working on it, and then like 6 months to a year later, you're like, I don't know. I don't think I know anything. I don't think I know enough. I may need to take another intro course. So maybe you sign up for another intro course. Or they start investing and reading a ton of books. And then you just get more information in your head after you just had 28 hours of information that you clearly didn't fully comprehend, or it wasn't the course for you. Then you go and put more information in your head, signing up for another course and like confusing yourself with even more, investing in more books. You try, and then you give up. Or sometimes you're attending these conferences and you're like, if I just hear more people talk about this, maybe I'll get it. Or if I just get a mentor, maybe I'll get it. But that's not the way it works. It's not the more you invest, the more you learn. the more you earn, I'm sorry, the more you invest, nobody's paying you more. Nobody's like, oh, you took 3 intro courses and you took 5 specialty courses or 5 advanced courses. Oh my gosh. Yes, I want to pay you $550 a session. You're worth it. You might be worth it, but come on. I think you know. That's the problem. You're spending more money, you're not making more for it, and it shouldn't have cost you all of that to get there. But it's not an easy road. And so a lot of people fall into that trap by not just doing the right steps the first time. Okay? Dental professionals are losing their investment at 3 times the rate of other professionals. So for as much as hygienists will complain, oh my gosh, everybody and their mom is doing myofunctional therapy. We've got massage therapists doing it. We've got nurses doing it. We've got occupational therapists doing it. Everybody's doing it. Yeah, because hygienists can't figure it out, at least to the rate of excellence upon which we should be at a standard. Okay? With all that said, anticipate that you also don't know enough about your scope of practice. Other professions don't know anything about your scope of practice. You don't know anything about other professions' scope of practice. And let's just understand that it's not a thing. It's never been a thing. Myofunctional therapy is not like its own field per se. It's not a thing. There's not enough research on it. There's not enough like standardization. There's so many different options for courses. Like it's just not a thing. If you don't understand scope of practice, that's going to be the biggest part of why people are failing or why people are dropping out. If I hear one more time that it's illegal to perform myofunctional therapy in New York, I think I'm going to scream. It is absolutely not. And I need to see, when you're talking about illegal, there has to be legislation. Point me to the legislation. Don't point me to a letter that had not been reviewed by any sort of attorney. The conversations I have with attorneys, you would love. You would love. But people think they go and they Google something and you know everything. You know nothing. You know nothing. We all know nothing. Like, stick to your wheelhouse. My wheelhouse is not law. Maybe one day it should be. But the conversations I have with lawyers about the ridiculous things people post on the internet, it's not easy. Okay? So let's get real about myofunctional therapy, because it's not a thing. It is not a thing. There's no illegalities. It's not regulated. There's zero legislation on it. All the legislation that you would find will be in a Speech or Audiology Practice Act, and it will say oral facial myofunctional disorders. It does not say the practice of myofunctional therapy. Oral facial myofunctional disorders, which does not comprise, in my opinion, myofunctional therapy, at least as its own profession, especially when all of my paperwork, all of my documents, even the legal ones, like my terms of use, my privacy policy, my full disclaimer, my informed consent, say proper oral resting posture. Show me oral facial myofunctional disorders. You're not going to find it. You're not going to find it. At least not on anything that's legal. So there's no regulation. The research is shoddy at best. Shoddy at best. Most of the research that's out is research that's about a handful of exercises or random provider selected things, and we don't know who the providers are, what their selection is based upon, if they do a cookie cutter program. How do you know that what you do in your program, which is who were you taught by, or is it an amalgamation of like the 3 different intro courses you took? How do you know that what you do in your program is going to replicate the results of a particular study that you're referencing to say that myofunctional therapy is evidence-based? I'll wait. There's no way to do that. What we have for research is not actual research. It's case studies. It's very low level, low hanging fruit. What we do have in claims of being like meta-analysis or systemic reviews are not actually systemic reviews. It's reviews of these same sort of articles where there's no standardization in how the myofunctional therapy is done and it can't be replicated. And many times there's a wonderful, sorry, it's like another slide or two away, but there's a wonderful lecture I did about all of that where I went through all of the reasons why myofunctional therapy is not evidence based, how it's evidence based, and essentially how it's a pseudoscience. Please go back and watch that. I think it's called The Great Myofunctional Debate or The Great Myo Debate or something like that. Go back and watch that if you really want to understand. But it's a pseudoscience, it's not a thing. Sound therapy has the same level of basis as myofunctional therapy. When we talk about, I watch a lot of Ray William Johnson now. I really just came upon him like last year, even though he's been like YouTubing and telling all these awesome stories for years now. I just came upon him from last year. Every time he talks about a polygraph test, he's like, it's a pseudoscience. And he talks about it with such like disgust that it really makes me giggle because I'm like, I think he would hate myofunctional therapy. Like, it's a pseudoscience. But it's a pseudoscience. There's nothing wrong with that. Chiropractic care is a pseudoscience. I don't know if you've ever been in a room with like physicians who have the utmost disrespect for chiropractors, who don't like that they're even considered doctors. It's kind of funny, but it's a pseudoscience. It's not something that's legit. And what you can take from that is that chiropractic care didn't dissolve away. It didn't just disappear into the ethos because it's a pseudoscience. There are plenty of pseudosciences that exist and have eminence based backing to them. So, eminence based is exactly what we get, those happy accidents that we get when we do myofunctional therapy. So, you're doing myofunctional therapy, you establish proper oral resting posture, and oops, your AHI is better. Yay! I can see that in some cases. That's isolated. I'm not doing anything that's going to repeat that per se. Who knows in the next person, it might not change their AHI at all. It might just stabilize them, leave them right where they're at. That's okay. It's a pseudoscience. There's no shame in that. Every chiropractor, every energy worker, every like energy worker, like a Reiki master, I'm a Reiki master. Don't put any disrespect on energy work because I'm telling you, I've seen much more powerful stuff happen with that than with any myofunctional therapy. I'll tell you, myofunctional therapy has got to be like the least dynamic thing that I do. But breath work, pseudoscience. It's all a pseudoscience. And that doesn't put any disrespect on it. It just acknowledges that, look, this thing is not proven in the same evidence-based way that we carry ourselves in our professional fields of licensure. And that's okay. It's okay for it to not be a thing. Okay. And in that, remember this slide from earlier? Myofunctional therapy is not the answer to everything. And so many therapists get caught up in that. So many people feel like, oh, I'm going to help all these people. I'm going to help them with sleep, or that's what I want to work on. I want to work with just TMD, or I'm going to work on just digestion or just women's health. I'm going to work on that. Okay, you can work on that, but you're not going to work on it alone. You're not in a silo. You don't help people with these things by only doing myofunctional therapy. You're going to have to refer them out for other types of things. Refer them out for body work, for structural care, orthodontics, orthodontic care, surgery. You're going to have to like expand your network, expand who it is you're working with, because all of these things are so essential. You can't fix everything with myofunctional therapy. You can fix one thing with myofunctional therapy: proper oral resting posture, period. That's it. That's all you're doing. Proper oral resting posture. Okay. So don't get ahead of yourself. If you're really confused about what myofunctional therapy is, why it's not a thing, how all of that relates to legislation, why is there even like this random war between professions over something that's not a thing, you got to go backwards to this state of the field address that I did. It's on my YouTube channel. Like, please, if you're not subscribed, you're missing out. There's a whole lot of information, like a wealth of information that is there. If you don't understand how laws are made, if you don't understand why nobody cares about myofunctional therapy because nobody knows what it is, I can ask a room of 10 myofunctional therapists and I guarantee you I'll get 10 different answers on what myofunctional therapy is, how it is, what it works, like what does it do. Nobody knows what it is as far as the general public. When it comes to dentistry, when it comes to speech, when it comes to, it's even less than when we go into some other professions. But when it comes to dentistry and it comes to speech, less than 1% of the licensed professionals are practicing in the myofunctional field, both of those professions. Now let's talk about PTs. You've got less than 1%, probably less than 0.5%. Like nobody cares. Nobody cares about it. Go do Family Feud style, asking a bunch of people, and nobody is going to be lobbying for it. Nobody is legislating for it. Nobody cares about myofunctional therapy. And if they started to care enough, there would be insufficient research to support it, and that would be it. Like, dead that talk right then and there. There's a reason why there's no legislation for like personal training or energy work, why there's no Reiki board in all of the states. Like, there's a reason why. What are you regulating? Nonsense? That would essentially be what they're going to ask. Like, what are we regulating here? You have absolutely no substance. Like, what are we regulating? And I'm okay with that. I am totally okay with that. I can practice with confidence doing breath work, doing Reiki, doing Myo, knowing that I'm practicing with excellence. I don't have anybody who I don't get results for the things that I'm going for, right? If I'm doing energy work, the energy work is not fielded through me. They have that and they own that autonomously. I am just a conduit of energy, but their movement of the energy, that's them through their body. How the energy is going to respond to them, that's them and their body. How the breath is going to heal, that's them and their body. How Myo is going to help, I'm just like a coach. I can give you all of the information, but you've got to be your own conduit for healing, and you've got to do all the work outside of our sessions. It's incredibly important. Okay? So please, 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 please understand. And nobody cares enough for legislation. So stop with that argument. Nobody needs it. It's not a thing. Myofunctional therapy is not a thing. It's not going to resolve all the problems, and it ain't easy. Okay? These are the very, very deep, dark truths that nobody wants to talk about except for me, but I'm telling you now, 5 years from now, I think everybody will be talking about it. Okay? So, for you practitioners out there who've listened to all of that and you're like, I'm so like confused. I don't know what to do. I feel like this is really all dark and scary and it's okay. It's an emotional whirlwind, and there's nothing wrong with that. Okay? You will be successful if you just take all the garbage aspects of it and you just proceed with a bit of excellence. Okay? Make sure you are proceeding in a way that you would want your loved ones to be represented. I am going to put a nice little banner up if you would like to chat with me about myofunctional therapy in any sort of regard. That is my link, my calendar link. It's a bit.ly link. Just type it into your browser and you'll get access to me. I'm happy to meet with you, to chat and to talk and figure out how you can get on the right track. If you're off the track, how you can get onto the track of becoming a myofunctional therapist if you're still interested after all these dark truths, or how you can find the best myofunctional therapist to work with if you happen to be a prospective patient and you were listening this far and you're like, wow, that's a lot. I don't even know if I want to work with a myofunctional therapist. Trust me, you do. Trust me, you do. And I can help connect you with whoever you need. Okay. All right. It is with this and with the utmost respect and grace that I will bid you adieu. Nobody gave me a hi, hello in the chat, so I don't even know if you heard any of what I said, but hopefully you did. And hopefully I wasn't talking into a void where, I wasn't being heard or understood. But I hope everybody has a fabulous evening. I will see you in 2 days with the OMT Dream Team, where we will be diving into all of the different ways that Myo really helps to complement different medical and various other specialties. All right. All right, everybody. Take care. Be blessed. Bye.